How does an echocardiogram check your heart for stroke risk? Imagine a tiny ultrasound probe that can see inside your heart without making a single cut. That's what an echocardiogram does. It uses sound waves to produce detailed images of your heart structure and how it's working. This test is especially important when doctors want to understand your risk of having a stroke caused by heart problems. There are two main types of echocardiograms. The first is called transthoracic echocardiography, which is non-invasive and involves placing a probe on your chest to get pictures of your heart. The second is transesophageal echocardiography, where a thin probe is gently inserted down your esophagus. Because the esophagus is close to the heart, this method provides clearer images of certain parts of the heart that might be harder to see from outside. During the test, the ultrasound waves bounce off the heart structures and return to the probe, creating real-time images. These images help doctors look for specific issues that could increase stroke risk. For example, they check for blood clots in the left atrium, which is a small chamber in the heart. Clots here can break loose and travel to the brain, causing a stroke. They also look for clots in the left atrial appendage, a small pouch that's a common site for clot formation. Another thing they look for is spontaneous echo contrast, which appears as swirling patterns in the blood. This indicates blood is moving sluggishly, raising the chance of clot formation. The test can also detect a hole in the heart called a patent foramen ovale, which might allow clots to pass from the right side to the left side of the heart and then to the brain. In addition to spotting clots and holes, an echocardiogram assesses how well your heart is pumping. If the heart's left ventricle is weak or the left atrium is enlarged, your risk of stroke could be higher. The findings from the echocardiogram are often combined with clinical risk scores, like the CHA-DS2-VASC score, to give a more complete picture of your stroke risk, especially if you have irregular heartbeats like atrial fibrillation. Doctors use echocardiography not just to diagnose potential causes of stroke but also to guide treatment. If they find a clot or other abnormality, they might recommend blood thinners or other therapies to prevent a future stroke. The test can also help decide if procedures like cardioversion, which restores normal heart rhythm, are needed. In essence, an echocardiogram is like a window into your heart's health. It helps identify hidden problems that could lead to stroke, allowing doctors to take steps to protect you. If you're concerned about your heart or stroke risk, it's always best to talk with a healthcare professional who can recommend the right tests and treatments based on your individual health. Remember, understanding your heart's condition is a key part of preventing stroke and maintaining overall health.